Hello, Assalamu alaikum. I'm Dr. Bushwereb, family physician from UK. Today I'm going to present depression. I started this channel just to increase the knowledge and awareness of the common conditions which the family doctor sees on a daily basis, just to empower you, of course, with the knowledge. I recently uploaded some videos about common cases in the GP land, just explaining about the symptoms and treatments in a simple way, without using any medical terms, so the normal person who is non-medical can understand it, but hopefully even doctors who are watching, whether it was in UK or even in Arab countries, they can benefit from these videos. So yeah, I did the Arabic version, but also I'm planning on doing the English version at the moment. Okay, so if you're watching this video and you suffer from low mood, I'm going to ask you two questions, and even if you go to your family doctor, whether you're in UK or outside of the UK, most likely they will ask you these two questions. They call them the screening questions. The first one: did you ever felt hopeless or worthless recently? The second one: did you lose interest in the things you usually used to like, such as hobbies, work, socializing, anything like that? So if you answered yes on any of these questions, not necessarily you have depression, but it might indicate that you might suffer from low mood. So the next questions will be: how's your sleep? People with depression, they have sometimes strange patterns of sleeping. Sometimes they oversleep, they sleep too much, they're always tired, they sleep at night, they wake up in the morning, and then even in the afternoon they sleep too much. They don't have energy to do anything. Or the opposite, they have deprivation of sleep. They say, well, doctor, I couldn't sleep all night, I need a sleeping tablet. So sometimes depression comes as that. Appetite, people with low mood, sometimes they lose interest in eating, or the opposite, they might have overeating and put on weight. How is work? Is there any bullying at work? Are you still enjoying work? Because sometimes if there's any problem during work, if you work in a stressful environment, on the long term, that can cause low mood. So that's very important also to address it and know what job are you doing. Gender is very important also, because studies has shown that men in the middle age who are single, not married, divorced, or if they lost their job, they're more prone to have depression, and even the suicidal rate is higher among them than female in the same age. Any problems in the family, any family issues, any recent bereavements, loss of family members, any divorced, any problems with a partner, problems with kids, any recent illnesses, did you notice that in one of your family member? For example, sometimes they tell you, well, I have depression, I have low mood because my mom had a stroke, my father had, for example, a cancer, something like that in the family, which can affect sometimes your mood. Suicidal ideas. Sometimes people with low mood, they wish if they're better off dead. They have suicidal ideas, and many of them even who wish if they're not alive, they will tell you the only thing which prevents me is my faith, or sometimes even my dog, my cat, or even a family member, because they have kids. They wouldn't do it for the kids. So did they ever feel like this? Any ideas about harming themselves? From my experience, in the UK, sometimes the most common, there are different ways of harming themselves, but sometimes they overdose, sometimes even they use a sharp objects, just to cause some cuts, they bang their heads, things like this. Any ideas about harming others? Of course, if somebody has these ideas, that's an alarming bell, that's a red flag. And I will tell you later in the treatment section what needs to be done. But that needs like really, it's a red flag, and it needs like an urgent medical attention. It's very important also like to know, I mean, of course your doctor will have to ask you this question: do you smoke? Do you take any drugs, like which your doctor didn't prescribe you? Sometimes depression can come as aggressiveness and anger towards others, and even sometimes towards yourself. You don't like yourself, like you start to feel guilt of everything. And I think this is a problem which you see a lot, especially like angry patients. That's one of the things which, the first thing, like before even we start training, like in the UK as GPs, the first exam, the entry exam, they have to bring you like a scenario of an angry person, an angry patient, and he comes with something else, but then on the deeper level, actually it was the mood which is causing that. And I think that most likely, working in the UK, like English people, they have a lot of awareness, and they tell you I'm always angry, I snap very quickly. I'm not really sure, is that because of my mood or because something else? That's the common thing they will tell you, because there's a lot of awareness about mental health. But I'm worried that in the Middle East, maybe mental health is not like, the awareness is not too much, and sometimes like people feel like maybe anger or anything, but it could be like the problem could be like underlining. It could be that they suffer in silence with low mood, and it's just like they don't know how to seek help for that, and that can come as I said, like as maybe aggressiveness when you drive a car, or angry or anything. So if you feel this way, don't blame yourself. Don't be harsh on yourself. Just speak with somebody trusted, maybe like a trusted like doctor, a trusted relative. And I will tell you later about what's the best thing and the safest thing you should do if you feel this way. Of course, any voices, hallucinations, like if the voices are telling, sometimes like a patient will say like, well, I'm hearing voices always, and I cannot sleep at night because of that. And sometimes they have like more than one voice telling them, even like, like horrible things, like the voice is telling them that to do bad things to themselves, or even like in their life. So if that happens, that means that depression is not like just a simple depression where your family doctor can treat that. That usually needs like a referral to the psychiatric doctor. So you have three things. You have your family doctor, okay? I'm speaking about the UK and Canada and America. That's how it is. And because family medicine in Middle East is not, in some countries like Libya, for example, I'm originally from Libya, it's not well developed. So straight away, if somebody is hearing voices, they will go to the psychiatry doctor. But I'm speaking about the UK, the first line would be your family doctor. So if you tell your family doctor, or if you know one of your relatives is hearing voices, that needs to go to the psychiatry, which is like a doctor specialized in psychotic illnesses. Because that can indicate other things. That can indicate it could be schizophrenia, it could be bipolar, it could be mania, it could be any other thing which needs like proper treatment. Sometimes women before the period, they suffer from low mood, and that has a name, a medical name, which is premenstrual attention syndrome. Most women they have it, but I think it's different from a woman to a woman. So sometimes some girls have it, and it's just like for 1-2 days, which is tolerable. But the problem, some women, they cannot really tolerate it if it starts to become like even up to maybe a week or even 10 days before the period, and that's a chunk. That's a lot of days in a month. So imagine if a woman is suffering like for 10 days with low mood before her period. That's too much. Sometimes even if it affects her work, her social life, affects her relationship with her partner, and sometimes even they seek like for medical attention. And I think my advice is, if you suffer and it's not just like a few days and you feel like it's really affecting your life, just speak with your family doctor, your GP, and they can always like discuss with you about what's the best treatment for it. Also, like women during their menopause, because of low estrogen level, Sometimes it can come as low mood. If somebody is suffering from chronic diseases such as cancer, heart failure, high blood pressure, any problem, or any like bereavement or anything, that can, or if they have like more than one chronic illness, that can increase the risk of having low mood on the long term. So what is the best treatment for low mood and depression? It's sometimes just like refer to psychologists, that can be enough. There are different options with psychologists. They have the time more than the GP. So they will ask in depth about like if there was any trauma in the past or any like problems. You can choose whether you want face-to-face or whether you want telephone consultation with them, or even sometimes like some patients say that, well, we don't have the time with the psychologist because they have a busy life. So even like they choose to do like online treatment with them. They give them like some like homework or some websites where they can just follow, and that can really like help. A trial of antidepressants can help, such as one of the famous drugs which they like to like following the UK national guidelines could be sertraline, citalopram, fluoxetine. Sometimes there's some side effects with these medications. First of all, they get worse before they get better. They start to work after 3 to 4 weeks. You start to see some benefits. They will make you, how they basically work. They increase the happy hormones, the serotonin, because people with low mood, they have like less serotonin, which is the happy chemical. In young people, like who are less than 30 years, having like sertraline and citalopram, it can increase the ideas of harming themselves or even suicidal ideas if they had it. So that's why if your doctor will start you on these drugs, you need like follow-up and monitoring. So that means you need to see them after 2 weeks, and sometimes they can start you, most likely they're going to start you on a small dose and then increase it if needed. Of course, if there's any ideas of harming, if there's any any ideas about self-harming or any suicidal ideas harming others, if you're listening and you're in the UK, straight away it will be the crisis team. Usually there's a crisis team number where your doctor, your GP should give you, or if it's within working hours, it will be your family doctor, your GP, or if it's out of hour, that means you need to call the out of hour number or go straight to the A&E. If you're listening and you're outside of the UK, that means you have to go to the A&E, or if you have like a system of out of hour, or speak straight away with your family doctor, or even if you have the number of your psychiatrist or psychologist, and tell like a trusted family member. That's very important. Follow up, of course, with your doctor is the best thing. You can't just have like one appointment and expect after that, well, a magic will happen. An antidepressant tablet, it's not a magic wand. Okay, it has to be like a process of accepting sometimes bad things which happen in life. The main problem why people get depressed, it's all about, there's different reasons. It could be maybe, as I said, secondary to things, like if there was an illness or bereavement or anything. But sometimes people feel depressed and there isn't a cause. Life is hard, and it's not easy. So sometimes dealing with life, with expectations and with difficulties in life, it's not an easy thing, and that's where the family comes, and that's where also like the psychologist sessions are quite helpful and good. And as Allah mentioned in the Quran, whoever turns away from my remembrance, indeed he will have a depressed life. And he also mentioned that in the cows chapter in the Quran, and we will surely test you with something of fear, hunger, and loss of wealth and lives and fruits. So why did Allah said like why did God say that? It's surely He will test you. That means that it will happen. It will happen that you will have bereavement, you will lose. Sometimes you will lose. A lot of people lose their job. They might fail an exam. It will happen, and that's all part of life. We're not living in heaven. That's in the second life, and that's why sometimes some of the patients, when I speak with them, I tell them, well, will you suicide or anything, even if they feel like really low, because like, for instance, if they have an illness or terminal illness or anything, they'll tell you, no, my faith. So faith will help and can help with low moods, and it prevents from like, it can save you. It can save a person if their mood is really, really low and they hit the rock bottom. Thank you very much for listening, and please, if you have any questions, please just write it in the comment section. Thank you very much.